Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. University dons at an international conference on education say lack of digital preparedness is responsible for education lag during lockdown. And Dr. Mukhtar Mohammed of the Presidential Steering Committee on COVID-19 addresses changes on the red list and Nigeria's vaccination mandate. He joins us later on the program. And Russia reports its highest one-day infection count since the pandemic began. Medical scientists have harped on the need for vaccine manufacturing on the African continent to extinguish over-reliance on global supply, which is exposing Africans to supply chain risks such as the one experienced with the current COVID-19 vaccine challenges. In a lecture series by the Africa Centers for Disease Control titled A New Public Health Order in the 21st Century, a panel of experts highlights a number of actions to expand Africa's pharmaceutical manufacturing capability to include strengthening regulatory environments, eliminating procurement challenges, more access to finance, skilled manpower, and a clear coordination among member states and sectors as critical to moving Africa's manufacturing forward. Meanwhile, Nigeria recorded 5 fatalities from the coronavirus pandemic, with 251 new cases last night reported across 13 states and the FCT. The NCDC also reports that over 3 million tests have been conducted across the country, while the 5 states topping the testing chart include Lagos, the FCT, Rivers, Kaduna, and Plateau states. Here's more on the virus update.
251 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 13 states and the FCT, indicating an increase from the figures reported earlier. FCT logged the highest infections with 78 cases, followed by Lagos, which had 46. Kaduna recorded 27 cases, Rivers had 21, Imo 16, Edo 13, Delta 12, while Plateau registered 10 cases. Other states, including Niger, Bauchi, Kwara, Akwa Ibom, Benue, and Nasarawa, registered a single-digit infection. There were no cases reported from Sokoto State. The new tally has increased the total confirmed cases in Nigeria to 208,404. 187 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 196,123. Lagos is leading the chart of states with the highest number of cases currently on admission, followed by the FCT, Delta, Oyo, and Akwa Ibom states. There were 5 additional deaths from COVID-19 complications reported in the last 24 hours, raising the fatality toll to 2,761. Currently, there are more than 9,000 active cases in Nigeria, while over 3 million samples have been tested so far. More than 5.2 million eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while over 2.4 million persons have been fully vaccinated so far. In Africa, there are more than 8.4 million confirmed cases, and over 214,000 deaths have so far been recorded across the continent. The total global confirmed cases have surpassed 239 million, while deaths are beyond 4.8 million.
And lack of preparedness is one of the reasons for the out-of-school numbers during the coronavirus pandemic in Nigeria. This is the opinion of the Vice-Chancellor of the Federal University, Dutse, Professor Abdul Karim Sabo, who spoke during an international conference on educational challenges amidst the pandemic and the way forward. Our correspondent Sadiq Ilyasu reports.
To control the spread of COVID-19, during the first wave of the disease, the government at the state and federal levels ordered the closure of schools for several months. Although schools have now resumed, the Faculty of Education at the Federal University, Dutse, in Jigawa State organized a conference with the aim of providing solutions in time of a pandemic.
Lack of access to e-learning facilities or e-learning technologies is considered to be the largest or the biggest barrier for learning during the pandemic. where learners in rural communities are the most affected. In its response to the challenges and the current situation, the Faculty of Education came up with a conference to discuss these issues and challenges. They did that by bringing together intellectual minds with empirical and scientific solutions to cushion this damning situation.
Other speakers at the event believe a paradigm shift from the way lessons are learned is the key to solving the problem.
Even when the National Open University tried to do examinations online, very few of its students were able to log online and take examinations. Something more definite needs to be done. There should be a paradigm shift. There should be a policy for information technology.
While other aspects of life have seemingly returned to normal, the academic sector is still struggling to cope with the effects of the long-term closure. In the new normal, online learning can no longer be discounted. In light of this realization, participants at this conference expect that the recommendations proffered will be looked into by the authorities concerned.
The governor of Ekiti State, Dr. Kayode Fayemi, says it took creativity for more states to have been able to wriggle out and survive the economic blow dealt by the coronavirus pandemic. The governor, who played host to the vice president and some other governors at the Ekiti Economic Investment Summit to mark his third year in office, says the pandemic has forced states to innovate on revenue generation as more income are being realized in the unthinkable circumstances of the moment.
As we're all aware, the economic impact of COVID-19 pandemic left most countries and most economies reeling. And Nigeria was not immune to this. Thankfully, through a set of deliberate actions, we have now exited recession, and our economy is back on track, with Q2 2021 GDP numbers coming in at an impressive 5.01%. These results demonstrate that with sincerity of purpose and cooperation between the federal government and states and the private sector, we can grow our economy significantly and put tens of millions in the jobs they so desperately need. Ekiti State, like other states, was not immune to the economic shocks resulting from COVID-19 pandemic. Our productivity took a hit as we prioritized the safety of lives and instituted a proactive lockdown that minimized the impact of the pandemic on our people. We also introduced fiscal reliefs to cushion the impact of the lockdown on businesses, which significantly affected our internally generated revenue, especially in Q2 and Q3 2020.
As it stands, all restrictions on nationals from Turkey, Brazil and South Africa have been lifted, with non-Nigerian passport holders and non-residents who visited Brazil to be allowed into Nigeria. They must, however, comply with the provisional quarantine protocol for travelers arriving in the country. Joining us to talk more about this, Dr. Mukhtar Mohammed, Incident Manager and National COVID-19 Response Center of the Presidential Steering Committee. He joins us now virtually. We'd like to thank you for joining us on the program.
Thank you, Millicent. Good evening.
Good evening. What informed the decision to remove Turkey, Brazil and South Africa from Nigeria's COVID restriction list?
So the COVID-19 situation globally has been a dynamic one. For us in Nigeria, we have reviewed the happening globally and in various countries. These particular countries, about 3 or 4 months ago, had a rise in cases. We've seen increase in the number of cases, increase in positivity rate. We've also seen increase in mortality, hospitalization and mortality in those countries. And because of the high traffic volume between Nigeria and these countries, they constituted a risk for us in terms of importation of the Delta variant. But we've been reviewing the situation every 4 weeks since that time. You recall that in mid-September, we had removed India from the list because we have established that the pandemic is actually subsiding. in India, and all the parameters that we were monitoring have actually turned out to be low. Last week, we also took a very deep review of what is happening in the remaining countries, Brazil, Turkey, and South Africa. And we have seen consistently that over the last 4 weeks, particularly South Africa, the number of cases has gone down, their positivity rate has also gone down, and most importantly, their vaccination coverage. The same thing applies to Brazil. Turkey had a little spike in the number of cases, but if you look at it on average also, the number of cases has gone down, their vaccination coverage has also improved, and therefore they no longer constitute the risk as we imagined for the importation of the Delta variant. Besides, in our own country now, over 90% of all new cases are actually the Delta variant. So really there is no need to continue to do that restriction. This does not mean that we have completely banished our so-called red list or the restricted countries list. It is still there. We are going to do another evaluation very soon, and will determine the risk of importation of either Delta or new variants into the country.
Dr. Mohammed, you said
which countries will fall.
Yes, you said the red list. Are there any other countries on the red list at the moment? And for these countries that have been removed from Nigeria's red list, what is the procedure now? Will they still have to be quarantined, the 7 days mandatory isolation? What now exists?
So we still have, the red list is not banished completely, but for now we don't have any country that satisfied the criteria. For these countries now, the implication is that they have been classified as the rest of the world with other countries. And that means if they are coming in, they will follow the normal protocol that every traveler to Nigeria will now comply with. And for now, our new protocol distinguishes between people who are fully vaccinated and people who are not fully vaccinated. People who are fully vaccinated are expected to have a PCR test at least 48 hours before they board to come to Nigeria. And when they arrive, they are also expected to take another PCR test within 48 hours to determine if they are infected or not. After that, they are now free to move to do their interaction in the society, and that is it. For people who are unvaccinated, it is different. People who are unvaccinated or people who are partially vaccinated will need to do the PCR before they arrive at the country at least 48 hours. And they also need to do a day 2 testing upon arrival in the country. They need to isolate for 7 days, and then they will need to do an exit test at day 7 to confirm that they actually are COVID-19 free.
Finally, Dr. Mohammed, on the issue of the vaccine mandates, especially to federal workers, isn't the deadline December 1 a little premature, seeing as how slow we're having vaccines come into Africa, talk less of Nigeria?
Our rate limiting step for vaccination was the availability of the vaccines. But for now, we've been guaranteed that we have adequate quantities of vaccines in the country. We have the Moderna vaccine, we have Oxford AstraZeneca, and the distribution has also been done to all states of the Federation. So vaccine availability now is no longer the challenge that we face. What we need to do is to come out en masse and make sure that we mobilize people to take these vaccines. Vaccine hesitancy for now is our greatest stumbling block to achieving herd immunity in the country. And the federal government now, after all considerations, decided that really we have to begin this vaccine mandate, particularly with the federal workers, so that we mitigate the risk, we reduce the risk around our offices, because people who are unvaccinated actually constitute a risk to other people and even to people who are vaccinated.
All right, we'd like to appreciate your time on the program. Thank you so much, Dr. Mokhtar Mohammed, Incident Manager, National COVID-19 Response Center of the Presidential Steering Committee. Thank you for joining us on the program.
Thank you, it's my pleasure.
Still ahead, travelers react to South Africa's removal from Nigeria's COVID-19 restriction list. Please stay with us. Welcome back. Reactions of relief have trailed the removal of South Africa from Nigeria's COVID red list. For nearly 4 months, the isolation on arrival policy for travellers from South Africa to Nigeria left many reeling with difficult experiences. Now the restrictions have been taken off. They hope if the policy becomes necessary again, it will be better implemented with less pain for travellers.
Decided to remove further South Africa.
It's the long-awaited news after nearly 4 months of all sorts of hectic experiences on many fronts.
Oh my goodness, very relieved, super excited. We've been through a lot, you know. COVID came, 7 months we were closed. And then at the point where we felt, oh, thank God we're opening up, things are looking great. And then we got hit by this.
So I think there were a lot of ways it could have been handled differently. It was quite a radical step. And certainly when Nigeria and South Africa were removed from the UK's list, we certainly expected that Nigeria would follow very quickly. So we are pleased that that at least has happened.
Weeks back, we brought you Dr. Ayokunle Akombi's experience along with his wife on their trip to Nigeria, which was aborted after the first day.
We haven't gotten far. The last communication we got from the Lagos State Biobank, that was 2 weeks ago. They requested for further documents, which we have sent to them, and we haven't received any further communications from them since then.
Nigeria's High Commissioner to South Africa, Ambassador Mohammed Manta, has defended the Nigerian government's position and policies, saying it's all based on the advice of scientists in the quest to curb the spread of COVID-19.
Nigerian government does not wish any Nigerian to suffer before coming back home or to suffer before exiting Nigeria. It is imposed on us like it is imposed in other countries.
But for many, it's not all about what was done. It was also about how it was implemented.
I'm also grateful to the government of South Africa for not reciprocating in that same manner. The way and manner in which we handled it, for me, being a Nigerian South African, I think we should have done it better.
We want the government to be more organic. It's very unfair to isolate travelers whereas other factors that limit the spread of the COVID-19 virus are not being addressed, especially the issue of social distancing.
With the world ramping up vaccination numbers and strengthening measures to ensure health safety protocols adherence, the hope is for the COVID-19 to bring no further severe surprises to the world, so life will get even closer to normal. From Johannesburg, South Africa, Betty Dibia, Channels Television News.
Meanwhile, the South African government has commenced with the development of a digital COVID-19 vaccination certificate, which will confirm that a person has been vaccinated in South Africa. According to the health minister, the certificate will be available through a person's smartphone, which can then also be printed out. Professor Jeffrey Mpalele is Deputy Vice-Chancellor, Research and Innovation. He joins us from South Africa. Thank you for joining us on the program.
Thank you for having me.
Tell us, have people started using the digital COVID-19 vaccination certificate?
Indeed. So approximately 1 million people have already downloaded this vaccination certificate because, you know, it's a way for the government to encourage people to get vaccinated. There are a number of campaigns, of course. This is not just the only way, but clearly with the vaccination certificate, you are able to access certain establishments. If we mention this week, actually there was a sport event and they allowed 2,000 spectators to come and watch the sport event. Provided they can show a proof of vaccination certificate. So it's something that obviously is here to stay, and not just for South Africa. It's a global thing because it's also advocated by the World Health Organization, and we know that in many settings it is very, very useful, especially when you travel to other countries. But I think the current situation now with the number of countries is to what extent these vaccination certificates will be used to access certain establishments.
But it's quite interesting because recently, perhaps yesterday, African ministers' delegation gave their position, and this is that the proposal of imposing vaccine passports for air travelers for Africans, they say that it was tantamount to discrimination against certain groups of the population and violating the tenets of the Chicago Convention. What's your take on the arguments for and against?
I think for travel, most likely some countries will require the proof of vaccination. It may be that regionally, the countries agree that there is no need to show that certificate. But certainly if you travel across continents, you will be required to show this vaccination certificate. We know, for example, that South Africa was actually on the red list of UK in terms of travel. They just, relaxed the rules recently. So this goes to show that without, vaccination certificate, you will have problems traveling to other countries.
Finally, the health minister said the certificate has been developed, talking about South Africa's digital certificate with fraud and other security protections, and saying that it will align with international standards. How unique is it, especially for South Africans traveling out, and how long would it take to get one?
So it's actually easy to get the certificate as long as you have been vaccinated, fully vaccinated, I must say, because currently South Africa is using 2 vaccines, the Johnson & Johnson vaccine, which is single dose, and the Pfizer vaccine, which is 2 doses. If you are fully vaccinated and you have got a vaccination code, you just go to the website and download the certificate. Then the certificate has been designed according to international standards, especially the WHO standard, and is recognized by a number of countries. And I think is part of the reason UK had to relax its restriction for South Africans to travel to UK. So it is a certificate that should be accepted globally as far as.
But looking at the number of vaccines that are available for Africa, is there enough for South Africans, especially to achieving herd immunity?
Well, the vaccination in South Africa is very interesting because the pace is slow, despite the fact that we have got a reasonable number of vaccines. However, I like to believe that, the issue of herd immunity is something that we initially thought it will happen for most countries, but there are a number of risks. And one of the important risks is the fact that, with the emergence of the variants, it could be that from time to time, we can't really achieve this goal of herd immunity. Because if we do get variants that are able to escape immunity that is elicited by the current vaccines, or immunity that is elicited by natural infection, obviously it means that the concept of herd immunity will remain an aspirational goal.
We'd like to appreciate your time. Thank you so much, Professor Jeffrey Mpalele, Deputy Vice Chancellor, Research and Innovation. Thank you for sharing your expertise with us on the program.
Welcome.
The U.S. mission in Nigeria has announced the arrival of over 3.5 million doses of the Pfizer COVID vaccine for Nigerians through the COVAX facility. The shipment arrived at the Nnamdi Azikiwe International Airport in Abuja today. It brings to more than 7.5 million the number of U.S. bilaterally donated COVID vaccine doses to Nigeria. A statement from the U.S. mission says the U.S. also contributed to the first multilateral donation of AstraZeneca vaccine in March this year. It says overall, COVAX has provided Nigeria with over 10 million vaccine doses till date. Let's take a look at the global update.
Russia has reported a record 986 coronavirus-related deaths in the last 24 hours and 31,299 new cases, its highest one-day infection tally since the pandemic began. The Kremlin has blamed the rise in death toll on Russia's slow vaccination campaign and has appealed to people to get the shot. Just around a third of the country's 43 million population has been inoculated. COVID-19 infections in Australia's Victoria has hit a pandemic record as Melbourne, the state capital, looks to end its lockdown earlier than planned next week. The surge in daily cases comes as the state nears a 70% double-dose vaccination rate among adults, a threshold authorities promised would end a months-long lockdown. And over in New Zealand, the country has reported its biggest rise in COVID-19 infections in 6 weeks, with all cases detected in Auckland, raising prospects of a further extension of lockdown restrictions in the country's largest city beyond next week. Some 1.7 million people in Auckland are under strict stay-at-home orders until Monday, October the 18th, as officials look to stamp out the highly infectious Delta outbreak, the first major spate of community cases in the country since early in the pandemic. And finally, Hanoi residents flocked to restaurants across the Vietnamese capital today as the government relaxed restrictions aimed at curbing the spread of COVID-19 for the first time in 3 months, allowing dine-in for restaurants to resume. According to state media, around 98% of Hanoi's adult population has received their first shot of the COVID-19 vaccine, while 50% has received both shots.
Russia can help reduce the spread of COVID-19. If you're meeting friends, head outside to help drive the virus away. Continue to take responsibility. You can visit our website for more updates, breaking news, a better understanding of the pandemic. It's channelstv.com. And that's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.